Welcome back, everybody, for another deep dive. This one's a little bit creepy, to be honest with it.
Yeah.
We were talking about a doctor in Berlin.
Okay.
He's suspected of killing 10 patients.
Oh, wow.
And investigators are saying that this doctor might have had a lust for murder. And this is giving me some serious Niels Högel vibes.
Oh, yeah.
Like anybody who followed that case knows that's not a good comparison.
Right.
So we're taking a look at this article from CBS News.
Right.
Published February 12, 2025.
Yeah.
Titled, German Doctor with Lust for Murders Suspected of Killing 10 Patients, Investigators Say.
Okay.
Let's unpack it.
Yeah.
What do we know?
So this doctor was working on a palliative care team, and that means that he was going into patients' homes, easing their suffering.
Yeah.
And he was allegedly ending their lives by giving them a lethal dose of medication.
Wow.
But the most shocking thing about it is that he also tried to cover up 5 of the murders.
How so?
By setting fires.
Oh, wow.
In their apartments.
So not just taking a life, but then trying to cover it up.
Right, and make just look like an accident.
Yeah. That seems incredibly calculated.
Extremely calculated.
Almost to a point where it's even more disturbing.
Exactly. Yeah, it really points to a level of premeditation that's, really scary.
Yeah.
And what makes this even worse is that this might have been going on for almost 4 years.
Oh, wow.
From September 2021 to the summer of 2025.
Yeah, it really makes you think about how many other people could be involved.
Right.
And the CBS article even mentions that at first, the investigators, they were only focused on 4 deaths.
Yeah.
But then they expanded it out to 10 victims after they started looking at all of his patient files.
Wow.
And even exhuming some bodies.
And now they're looking for anybody to come forward, if they had a loved one that was under this doctor's care, to see if maybe they were also a victim.
Right. So anyone listening out there, if you know anybody who might have been treated by this doctor, keep your ears open for anything suspicious.
Exactly.
And maybe reach out to those investigators.
Yes.
Now, this CBS article also mentions something else that really caught my eye.
Okay.
And it's the detail that made me immediately think of the Niels Högel case.
Yeah.
Prosecutors are saying that what this doctor did looks like lust for murder.
Wow.
And that's a term that I'm not really familiar with.
So lust for murder basically means that the killer, they get pleasure or gratification out of the act of taking someone's life.
Okay.
And that's different from some other motives you might see,
Right.
like financial gain
Right.
or revenge.
Revenge, yeah.
This is something internal,
Right.
a psychological drive.
Yeah, that's really difficult for me to wrap my head around.
Yeah.
Is there anything from the psychology world that can help us understand this type of motivation?
Well, we can think about it in terms of psychopathy.
Okay.
Where someone lacks empathy,
Right.
remorse.
Okay.
And they can be very superficially charming.
Yeah.
Which can hide a very dark side.
Right. But I guess not every psychopath is a murderer.
Of course not.
And not every murderer is a psychopath.
Exactly. But when we see these types of killings that seem like they don't have any other motivation behind them, it really does make you think,
Yeah. So it's not saying that this doctor is definitely a psychopath.
Right.
But it's saying that this lust for murder idea lines up with certain traits that you would see in psychopaths.
Exactly.
And what makes these healthcare killings so disturbing is that these people are already in a position of power.
Right.
And they can gain access to people who are extremely vulnerable.
Exactly.
And this is kind of what happened with Niels Högel,
Right.
the angel of death.
Yeah.
He was a nurse, and he injected patients with lethal drugs, and he killed over 85 people.
Yeah.
And he also seemed to get a twisted sense of satisfaction out of it.
Exactly.
It's scary to think that even in professions that are all about helping people, there are still people out there who can do such horrible things.
Exactly.
And this isn't just limited to Germany's, right?
Right.
We've seen similar cases in other countries, haven't we?
Yeah, in 2023, a nurse named Mario G.,
Yeah.
he was sentenced to life in prison for killing 2 patients
Okay.
and trying to kill 6 others.
Okay.
And he did this by giving them drugs that they weren't supposed to have.
Wow.
And then there's the very recent case of Lucy Letby in England.
Yeah, the neonatal nurse who was convicted of killing 7 babies.
Right.
But I think there was some debate about the evidence in that case.
Yeah, some experts questioned some of the medical evidence that was used to convict her. But,
Yeah.
Even with the debate about her conviction, it really shows that healthcare killings, they are a reality.
Yeah, a scary reality.
Yeah.
It makes you wonder, how can we protect patients from people who are in a position of power, but who might want to harm them?
That is the question, isn't it? It's definitely a complicated issue.
Yeah.
It needs a lot of different solutions.
Okay.
But we'll definitely get into that as we continue this deep dive.
Yeah.
Yeah, it really is the question. These cases, they really make you question how safe you are, especially when you think about how much we have to trust healthcare workers.
It's true. When we go to them, we're at our most vulnerable. We expect them to be caring and compassionate. And to think that somebody might take advantage of that, that's really scary.
Absolutely. So it's really important to understand what could cause this type of behavior, not to excuse it, but maybe to help us figure out warning signs or even problems within the system itself that might allow these situations to happen.
Okay, so let's talk about that. Are there any red flags that hospitals or clinics should watch out for? Maybe patterns of behavior that might suggest that a healthcare worker could be a risk to patients?
Well, it's tricky because, like we were saying before, someone who's a psychopath, they can be really good at blending in. They're charming, they're manipulative, and on the surface, they seem totally dedicated to their jobs. But there are some things you can look out for, like maybe a sudden increase in patient deaths or unexplained complications when a certain person is taking care of them. That might be a sign that something's not right.
So it's about being aware and noticing if there are any unusual trends or patterns.
Exactly. And it's also about creating an environment where people feel comfortable reporting anything that seems suspicious, without being afraid of what might happen to them if they do. Whistleblowers are so important when it comes to exposing these kinds of things, but a lot of times they face a ton of pressure and even retaliation.
That's a good point. There needs to be a system that protects those people who speak up.
Definitely. And beyond looking at individual red flags, it's also important to think about problems within the healthcare system itself. Things that might actually contribute to these tragedies happening. Like, we know that burnout and compassion fatigue are huge problems in healthcare. The long hours, dealing with suffering and death all the time, and the pressure to be perfect, all of that can really wear a person down, even the ones who are completely dedicated to their jobs.
Are you saying that all of that could actually cause some healthcare workers to lose their moral compass?
It's definitely something we need to think about. When you're constantly surrounded by suffering and death, and you're struggling to deal with your own emotional baggage, it can make it harder to empathize and make good decisions.
Wow, I never thought about it like that. So dealing with things like burnout and compassion fatigue isn't just about making healthcare workers happier. It could actually correctly impact patient safety.
Exactly. It's about creating a system that takes care of both patients and providers, because you can't have one without the other.
That makes a lot of sense. But let's go back to the idea of individual responsibility for a minute. Let's say, for the sake of argument, that this doctor in Berlin is found guilty. What happens then? What are the legal and ethical consequences? How does the justice system handle cases where someone who's supposed to heal people actually intentionally harms them?
Well, legally, these people are usually treated like any other murderer. They could go to prison for life, or in some places even get the death penalty. But ethically, these cases are really complicated
How so?
because it's such a deep betrayal of trust. Healthcare workers are supposed to be healers, not killers. And when that trust is broken, it affects the whole healthcare system. People get scared, they get suspicious. And it really damages that special relationship between patients and their doctors.
It's like they're breaking a promise they made to society to care for us. And it makes you wonder, what can patients do to protect themselves? How do you trust someone when you know there's a chance they might hurt you?
That's a great question, and it's something we all need to be thinking about, especially after hearing about these cases. We can't be afraid all the time, but we can be aware and know what to do.
So what does that look like? Can you give our listeners some practical advice on how to be more proactive with their healthcare?
Absolutely. The most important thing is to remember that you have the right to ask questions and to get all the information you need about your care. Don't be afraid to speak up if you have concerns or if something doesn't feel right.
So basically, don't just be a passive patient. Be an active part of your own healthcare.
Exactly. And if for any reason you don't feel comfortable with a particular doctor or nurse, you can always ask for someone else. It's also a good idea to get a second opinion if you're not sure about a diagnosis or treatment plan.
Those are great tips. But what about situations where someone can't really speak for themselves, like if they're unconscious or on strong medication? How do we protect them?
That's where family and friends come in. They can keep an eye on things, ask questions, and raise concerns if something seems off.
So it's all about having a support system and people who can hold the healthcare team accountable.
Exactly, and recognizing that everyone has a part to play in making sure patients are safe. We need to work together to create a healthcare system that's both vigilant and compassionate.
Yeah, it's a lot to process. It's disturbing, but in a way, it's also empowering. Like, it's scary to think that there are people out there who might want to hurt us even when we're supposed to be able to trust them. But it also makes me realize that I need to be more involved in my own healthcare.
I totally agree. It's all about finding that balance. You have to be able to trust the people who are caring for you, but you can't just blindly trust everyone. You need to be informed and involved and not be afraid to ask questions.
This whole conversation has really made me think differently about how I approach my own healthcare. I guess I've always just assumed that doctors and nurses have my best interests in mind, and I'm sure most of them do. But these cases are a reminder that there are exceptions, and we can't just ignore that.
Right, and it's not just about protecting ourselves. It's also about making sure the whole healthcare system is more accountable and transparent. If we see something that seems wrong, we have to speak up.
You mentioned before that this isn't just happening in Germany, that healthcare systems all over the world are facing these same kinds of challenges. Are there any countries that are doing a particularly good job of addressing these issues? Any examples we can learn from?
That's a good question. There are definitely countries that have come up with some really innovative approaches to patient safety and healthcare worker well-being. Like some of the Scandinavian countries have really great systems in place to support their healthcare workers. Things like mandatory reporting of adverse events and a real focus on preventing burnout and compassion fatigue.
That makes sense. If you create a system that supports and protects healthcare workers, they're going to be less likely to make mistakes or to reach a breaking point where they start to lose their sense of right and wrong.
Right, and it's not just about preventing harm, it's also about encouraging a culture of learning and improvement. When mistakes do happen, and they will happen, it's important to learn from them and make changes so they don't happen again.
So it sounds like it's a multi-pronged approach, supporting healthcare workers, empowering patients, being transparent, and creating a culture of continuous learning. It seems like a huge task, but it also makes me feel hopeful, like maybe we can actually make healthcare safer and more compassionate for everyone.
I'm optimistic too. As awful as these cases are, they force us to step back and look at our systems and see how we can do better.
Yeah, I think you're right. Well, for anyone listening who might be feeling a little overwhelmed by all of this, just remember that knowledge is power. The more we understand about these issues, the better prepared we'll be to navigate the healthcare system and to stand up for ourselves and the people we care about.
Absolutely. It's all about being informed, engaged, and taking control.
Well said. I think that's a great place to wrap up our deep dive for today. This has been a really intense but incredibly important conversation. Thanks so much for sharing your insights with us.
It was my pleasure.
And to everyone listening out there, we hope this deep dive has given you some things to think about. Remember, if you see something, say something. We all have a responsibility to create a healthcare system that's safe and compassionate for everyone. Until next time, stay curious, stay informed, and stay engaged.